It's my feel-good breakfast show.
Welcome back. You're live with Expresso as we delve into health matters, obviously COVID-19 and our third wave, and now our vaccinations firmly in focus. The violent unrest in the country has somewhat overshadowed the coronavirus pandemic that we are facing, but this does not mean that the virus has disappeared or lessened in any way. At least we are seeing some reprieve, but it's still hectic out there, and the third wave of COVID-19 infections continues to hit the country hard, with many more being infected and others losing their lives. It has hit home so many people that we know have passed away. Personally, it's incredibly heartbreaking.
It's heartbreaking indeed, and our trusted medical expert and infectious disease specialist, Dr. Emile Reid, is back on the hot seat in the studio this morning to give us a COVID-19 update and discuss the next phase in the vaccine rollout plan, what that's looking like. And if you have any questions about this vaccine, give us a call right now. The number is 021 110 5552.
It's auspicious that the rain is falling, as you can hear outside. It's blessing us. It's blessing us this morning, and I'm blessing you, you wonderful human being. I always feel like we need to do an emotional check-in before we start talking facts, because you are very much working on the front lines, and I'm sure sleep has been at a very short supply. How are things on the ground level?
Things are going bad, and I think for us working on the front line, we are dealing with it on a daily basis. And the one thing that is of massive concern is that people out there doesn't see the picture and what's reflected in what we see on a daily basis, with the amount of people being admitted to hospital. And I mean, we've been dealing with COVID for the last year and a half, but somehow it seems to stump people. People don't come to hospital when they should. They wait until they are very, very ill. And with vaccinating people in a pandemic is extremely difficult, as we discussed before. The elderly people who already got vaccinated are actually reaping the fruits of being vaccinated. Because if we look at our ICU numbers currently, our ICUs are full to capacity. And if you look at the average age, where first and second wave used to be around about 65 years of age, currently we're sitting on average at 42 years of age, meaning that the younger group are actually being affected more, and the elderly who has been vaccinated,
it's working,
it's actually working,
which is fantastic. Well, Doctor, yes, seeing the numbers and hearing what those stats are looking like on a daily basis when we tune into the news is one thing, but I think that the reality that you are faced with on a daily basis of all those ICU sort of spaces filled to capacity and not being able to help people really does paint the picture and bring it to life. But we've also been encouraged because we're seeing so many people reporting and posting all over social media that they've been vaccinated. I'm seeing the age group 35 to 49 now. Graham went for his one as well.
Kudos to everyone. I mean,
right?
You gave us a number, over nearly 1.5 million people signed up within 24 hours.
It's incredible.
Exactly. It's amazing. And it looks to be as if that specific group is more motivated to actually get vaccinated. And that's brilliant. That's what we want to see. And the most important thing that one should never forget is that those people that are at highest risk, the elders, people with comorbidities, that's probably still the important group that we need to get
risk factor
to be vaccinated. Because, as we said, we're not going to get rid or eliminate COVID-19 ever. We're probably going to have to live with it and control it on a year-to-year basis. So the pipe dream of herd immunity or population immunity is exactly what I said. It's probably a pipe dream, and we're probably never going to get there. But we need to vaccinate those people that are at highest risk.
What's the prevalent vaccine at the moment? What's doing the rounds in South Africa?
Currently we are using the Pfizer jab, and whereas the Johnson & Johnson is being used for healthcare providers. And at this point in time, I don't think people need to worry about which vaccine they actually get. The important thing is to get a vaccine.
Just get it in your arm.
And the reason for that is all vaccines currently are focusing on preventing death, preventing complications, preventing hospitalization. And that is where the work of the vaccine seems to be focused on. And if we look at the UK and the USA, they still have thousands of cases on a daily basis. But if you look at the hospitalizations and the number of deaths, it's extremely low. And people need to understand that vaccines cannot and will not prevent mild to moderate disease. And even if you vaccinated, you can still contract COVID-19. The important thing is you're not going to fall ill, you're not going to be hospitalized, you're not going to die, meaning that the healthcare services is not going to be overwhelmed.
Yeah, and that's the danger, I suppose, that's being mitigated by the vaccine. And such an important reason to step in there and get those to avoid that.
Well, and I can speak from experience, there are no adverse side effects that I've felt. A bit of a sore arm.
Yeah.
I haven't even had any flu-like symptoms or anything, but the governance around the system has been really reassuring. The fact that there's so much positive information, the second that you get the jab, you know, SMSs are coming through, talking you through the process, and you can kind of feel that there is a digital tracking of what's going on here. So it's all part of that very positive move forward collectively. Who is next in line?
Well, I think you know my feeling on this. I believe that anybody should be next in line.
You're ready, go, yeah.
And everybody that are motivated to get the vaccine should be able to access it.
Yeah.
So currently, with regards to government, they're looking at vaccinating the 35 to 49 group, although there's still a lot of elderly people that still need to get their jab. Teachers have been vaccinated, healthcare workers have been vaccinated. So it seems like on Monday, government also started to vaccinate the correctional services.
Brilliant.
As well as the inmates.
Brilliant.
Wow.
Absolutely brilliant.
We're moving in the right direction. Well, listen, Dr. Emile Reid is still here. Questions about the COVID-19 pandemic and its associated vaccines, give us a call, 021-110-552, and the good doctors will be able to answer your questions.
It's my feel-good breakfast show.
Welcome back to it, your feel-good breakfast show. It's Expresso live on S3. We're opening up to some COVID-19 information and education. Now, the vaccination rollout plan will continue with its next phase, and more people are encouraged to get the vaccine. We've seen lots of them get it. But what is the role of a flu vaccine during this time? Medical head at Soofie Pasteur Vaccines, Dr. Nasiha Soofie, joins us now via video call to tell us more all about it. Doctor, good morning. Thanks for the time.
Thank you for having me.
Great to be connecting with you at obviously a vitally important time for us, but also quite a confusing time because there are a lot of mixed messages, not necessarily coming from official sources, but out on social media, and it does seem to be weighing popular opinion. And one of those certainly relates to the flu jab versus the COVID-19 vaccination. So I'm going to ask some of the questions that have come through our fold here. And starting with this, will a flu jab protect you against COVID-19 at all? And who can get the flu vaccine?
Really good question, and I am not at all surprised by the question. So throughout the course of the pandemic, we have been receiving questions from the public asking, does the influenza vaccine provide any protection at all against SARS-CoV-2? So the short answer to the question is no.
No.
The influenza virus is very different from the SARS-CoV-2 virus. So the influenza vaccine will only protect you against the influenza viral strains that are circulating during the current influenza season. There is some preliminary data that shows some level of cross-protection to SARS-CoV-2. However, this data is still at this stage, you could say, being interrogated. So the short answer to your question is no.
No.
The influenza vaccine will not provide protection against SARS-CoV-2. But to bear in mind that the influenza infection is also quite fatal.
Okay, well then let's talk about if someone has taken the flu vaccine and they've already also had the COVID-19 vaccine, do they then, or rather if they've had the COVID-19 vaccine, would they still need to take a flu vaccine at all, or would the COVID-19 vaccine protect them, I suppose, universally against flu?
Again, good question. So the COVID-19 vaccine will protect you only against SARS-CoV-2. And the influenza vaccine protects you against the influenza virus. Currently, what we're seeing, and I'm sorry if I'm being a bit too comprehensive in my answers, but I'm really very passionate about it. So basically, these are two different viruses. And what we're seeing at the moment is that during respiratory season, during the winter season, we're seeing some sort of competition between SARS-CoV-2 and influenza viral circulation. And it's too early at this time to say which of the two viruses are going to dominate. We know currently for this influenza season, 100% SARS-CoV-2 is dominating. We're not seeing too many cases of influenza. But remember, these are two viruses. They are both mutating, and we don't know how that's going to play out in the future. So there needs to be an equal focus on both vaccines.
Let's get into the practicalities then of the flu vaccine itself. So what are the benefits and the possible side effects of having the flu vaccine?
Okay, so the influenza vaccine protects you against influenza A and influenza B. These are two types of influenza viruses that circulate during the influenza season, that is during the winter months. Now, the benefit here with regards to the influenza vaccine is more greatly appreciated amongst high-risk groups. Now, high-risk groups are pregnant women, HIV patients, individuals with underlying health conditions, so a patient with a heart condition, someone who is asthmatic or has chronic obstructive pulmonary disease. Healthcare workers who are on the front line must absolutely be prioritized for influenza vaccines. And the reason we say this is because if these individuals do get an influenza infection, they are likely going to suffer from a very severe form of the infection and may go on to developing a pneumonia, may be hospitalized, and in some cases may even die from the infection. In terms of side effects, the good news is, to the most part, side effects to the influenza vaccine are as you would expect with any other injection. So you could say a bit of pain at the injection site, some redness, swelling. The more severe adverse events like, for instance, breaking out in hives or Guillain-Barré syndrome, etc., are rare to none. In my experience, working in vaccines for a good few years now, I've not actually met anyone who's been excluded from receiving the influenza vaccine.
Well, we're chatting to the experts this morning.
Very lucky.
Dr. Nasiha, Soofie, we're very lucky indeed to have you join us and be able to answer all of these questions for us. And I think some very important detail and information coming through there. Dr. Emile, Reid, as well as Dr. Soofie will be answering more of your questions on the flu and the COVID-19 vaccines live right after this. We'd like to thank every single individual who sent through their questions. We are seeing those come through on all of our social media platforms. And you still can give us a call on 021 110 5552 if you do have questions. The doctors are on standby. Time for some music now.
It's my feel-good breakfast show.
Welcome back as we continue our discussion with, it's a health discussion, obviously being a Tuesday morning, infectious diseases specialist, Dr. Emile Reid, and medical head, Dr. Nasiha Soofie are still with us, and they are ready to answer all of your questions relating to COVID-19 and the flu vaccine. Thank you once again to every individual who sent through your questions and to those joining us on the line. And it seems like we've got someone on the line right now. In fact, Caroline, a very good morning to you. What is your question for either of the doctors?
Expresso team. I'm from Cape Town.
Welcome from Cape Town. Your question for Dr. Reid, what is it, Caroline?
Yes, thank you very much. I was tested and I started, or they tested me 7 days ago that I've got COVID.
Okay.
I've got my mom that's under her caregiver and she's 90. So I just had her self-tested yesterday. I haven't got results back yet. But she did show on Friday a little bit of a not feeling too well. But she's only got a little bit of a nose coat. Now, just to give a quick thing after that, I had my first injection, over 60 injection. My mom had 2 already. I'm not really sick, just a little bit of a flu and a little bit of chest. Definitely injection help. For anybody who wants to do it, please, injections does help. My question is, because of I've read that you've got 10 to 14-day period of being isolated with helping her. How do I count the 14 days from if she's COVID? Do I test it from the time that she started her symptoms, 14 days or 10 days, or do I just leave it on my 10 days?
Thanks, Caroline. It's a very good question.
So
Reid, yeah.
if I understood it well, is that she asked how long must she wait until her mom can go for a vaccine while having symptoms?
Caroline, is that the case? Or are you wanting to know how long, up until what time it's safe for you to be with your mom again? Or are you talking about getting the second injection, the second vaccination?
No. My question is that my mom has been vaccinated both injections
Great.
a while ago. The last one was on the 9th of July. I've had my 1 injection. Because I started my COVID, I've had COVID from 7 days ago, and my mom has been with me all the time because I'm a caregiver. I want to know how long quarantine period do I need to do? Do I need to do the 10, 14-day quarantine, or do I, if she tests today positive, do I continue my 14 as well with her another 14 days?
Does she need to start afresh?
Okay. The important thing is from your diagnosis of being COVID positive, you take the first day of your symptoms and you count from there. So if you develop symptoms 7 days ago and subsequently got diagnosed, you wait 10 days from the first day that you developed symptoms.
Okay.
So nothing more complicated than that. So it's not about the diagnosis, but in fact when you started developing your symptoms.
Well, Caroline, hopefully that answers your question. Thank you very much for giving us a call this morning. And please...
My mom started feeling a little bit yucky 4 days ago.
Okay.
So, and because of being in the same house and I'm a caregiver, do I now as well quarantine for her 14 days consecutive?
No, Caroline. You only quarantine for yours and not for moms.
Okay, Caroline, thank you so much. Great question. Thank you. I think a lot of people wanting and needing to know that.
Brilliant.
Then we've got another caller, Wendy out in Johannesburg. Wendy, good morning.
Good morning to you, team, and good morning to the doctor.
Good
My name is Wendy. I have a question which I've been trying to sort of grapple with and who to speak to about. I've recently been diagnosed with a female condition, which is precancerous cells of the cervix. My understanding is that my immune system may already be compromised, and would it be safe for me to have the COVID-19 injection?
Okay.
Dr. Nasiha is also on the line. Dr. Nasiha, would you like to answer Wendy's question?
Thank you for the question. So, unfortunately, we do not have a COVID-19 vaccine at Soofie Pasteur. I can answer in regards to the influenza vaccine, but with regards to the COVID-19 vaccine, I'm sorry, but I would have to return that question to Dr. Reid.
Dr. Reid.
I will gladly answer that question. So having precancerous cells on your pap smear means that you've been infected with a virus called HPV, the human papilloma virus, and meaning that it's not yet cancer, but it can in the next few years develop into something cancerous. So if you look at the weighing up the risks versus the benefits when it comes to COVID-19, I would support you to actually have the COVID-19 vaccination as soon as possible and get the precancerous HPV abnormalities also sorted out with a gynecologist.
Okay.
Wendy, does that
Great.
answer
Thank you,
your
Wendy.
question?
Yes, absolutely. Thank you so very much for
Thanks
that information.
very
I do
much.
appreciate it.
Be
Thank you.
safe.
Thanks,
Have
Wendy.
a
Have a
Pleasure,
lovely day.
Wendy.
Let's see, we've had a couple of questions come through on our social media lines as well.
Yes,
Nope,
those
we've got
have
another
certainly
caller
come
coming
But
through.
we do have Maggie. Maggie's out in Cape Town and has been on the line waiting to answer the question. Maggie, good morning, or to ask the question.
Good morning, team and Dr. Reid.
Morning, Wendy.
I'm phoning in connection with the registration of the vaccine. Now, I'm from Kensington, a suburb in Cape Town. So yesterday, my brother-in-law went to the day hospital to get vaccinated, and he was told he must come back with a code. So I just want to know, must you have a code when you want to be vaccinated and you are registered?
You should have received a code, surely, when you registered, yeah.
So Wendy, when you registered, you will actually get an SMS with a code. And in the private sector, that code will be accompanied by a date and a time as well. So as soon as you get confirmation of your registration, including the code, you can go directly to the place indicated in that SMS to receive your jab. So you don't need anything else, you just need that
You just got confirmation to say that you was registered and no code.
No. So the confirmation, as soon as you complete the form on the system, you will get confirmation, and soon thereafter, you will receive another SMS which will indicate the code as well as the clinic in your area where you can access the jab.
Okay.
Maggie, thank you very much for that. And hopefully, if that code can't be located anywhere on your phone or any one of your confirmations, do go back to that registration website. There is an inquiries contact number there, and maybe you can get in touch with that line and see where your code might be sitting. Thank you very much.
Should have received it.
Yeah.
Let's see if we've got some comments or questions coming through on our social media platforms. But we're actually going to call it there. Some really interesting questions coming through, so thank you so much to our callers. Dr. Soofie, apologies that we had no flu-related questions coming through, but you have been superb this morning in helping us highlight the very firm differences between the flu and the COVID-19 vaccination. So thank you so much for weighing in on our discussion this morning. And Dr. Reid, as always, just stay safe out there and look after yourself on the front line and keep saving lives. And once again, thank you so much for your contributions this morning.